I'm Sarah Prenger, and I'm the Senior Executive Director of Primary Care and Behavioral Health.
And I'm Brittany Montecuollo, the Vice President of Operations for the Parkville Market.
I love being part of the Sanford family because I love the people that I get to work with. I feel like I'm truly connected with them. I care about them. I get to spend my work days with people that I love, frankly, and who they share the same core values as me. They're here for the same reasons. They're here to serve our patients.
I love being part of the Sanford family for a lot of the same reasons. Additionally, I really appreciate the impact that Sanford makes on the communities that we serve. So our mission, I think, really spans outside of the four walls of the facilities that we have. And we are making sure that our communities are happy and healthy in really diverse ways.
We were inspired to create the Pineapple Fund after a group of our caring coworkers came to us and talked to us about some patients that were not able to progress on their healthcare journey because something was getting in the way. Most of the time it was something financial. They weren't able to afford their basic needs. And so they couldn't follow their provider's plan of care even if they wanted to because something was getting in the way. One of the first things that we were able to do with the fund was we were able to help. She was an elderly woman with diabetes, and she'd been doing so well for so long, and all of a sudden she's coming in and out of our emergency room, and nobody really knew why. Her diabetes was completely out of control, and what we learned was that she had been recently switched to a new formulation of insulin, an insulin pen, and she couldn't read the tiny numbers. So she was just guessing and giving herself all kinds of, different doses of insulin, and she needed a magnifying glass. And there's no, special magnifying glass funds out there. And so for $6, the Pineapple Fund was able to, help her. She's back on track, doing well, able to take care of herself where she couldn't because she couldn't afford a magnifying glass.
What inspired us to start the Pineapple Fund was our recognition of these very sort of simple and basic needs that our patients have, and
seem simple and basic, but are actually huge.
Have huge impact.
Yeah.
And so Sarah and I had worked so close together for many years, serving those patients in different ways, in different roles that we've had, both nurses by background. And so pineapples represent friendship, and it just so happened that it's a great phonetic way to represent our fund, which is providing needed aid to patients locally, PNAPL. What I would say to employees in encouraging them to give back, to move care forward, is that your contributions, no matter how big or how small, allow you the opportunity to give money and to help people in a way that is most meaningful to you.
Absolutely. Every single donation matters and can have a bigger impact than you can ever imagine. What giving back to move care forward means to me is removing what's in the way.